what questions or problems are you working to solve?
I am working on figuring out the safe doses to use in pregnancy, lactation, and in childhood for medications. So for children, we actually have a few laws in place that assist with trying to figure out how to develop medications so that they can be safely used in children, where the drug companies are required to do some studies in drugs that are likely to be used in kids. Those laws are relatively new in the last 20 years or so, so there are still plenty of drugs on the market for which we have no data on how to dose in babies and kids in unique populations. So there's plenty of work to be done in that area still. A lot of people may not recognize that the physiology in childhood is entirely different than in adulthood. So you can't simply just give them half the dose or a quarter of the dose based on size. You really have to understand what the child's body needs and when you need to adjust the doses as they grow and develop. So I was trained in pediatric pharmacology to learn how to study how drugs move through the body, especially in childhood, so that we can figure out the correct dose to give. At the same time, I got involved in a study looking at medication dosing in pregnancy, and this really captured my attention. I did not realize that there's so little data and so little evidence on how to dose drugs and medications in pregnancy. Most women who get pregnant use medications. Like the vast majority of women use medications. Most women use 4 or more medications during pregnancy, and practically none of those medications have any information whatsoever on the correct dose to give, whether it's safe, whether it's effective. And it doesn't mean you simply like decrease the dose or increase the dose just because you're pregnant. Each drug is different. So again, during pregnancy, the body changes substantially, and you may need to give a different dose to get the same effect during pregnancy. One reason that the pregnancy studies really struck me is that, again, there's so little data out there, and there aren't any laws that require drug companies to study medication dosing in pregnancy. There are a few rules and guidance documents that the FDA has available to, ask companies to track the use of drugs once they're on the market, in lactation and pregnancy, but there's very little sort of laws or rules or anything that we can use to really get companies to incorporate pregnancy in the drug development process. So most work in this area is done by academics and clinicians and foundations, and maybe more of the scientific or philanthropic side of companies, or companies in partnership with the National Institutes of Health. And so it's really challenging to do studies in pregnancy. A lot of people feel it's unethical to study medications in pregnancy. What happens though, when you don't do any studies, is that every pregnant person and their caregiver is now basically, operating in complete darkness with no evidence on which to base their decisions. And it's really important to treat disease during pregnancy. A number of, pregnant people have a disease that has to be treated during pregnancy, or they'll have bad outcomes for the mother, bad outcomes for the infant. So knowing that you have to use medications in pregnancy a lot of times, then not knowing the right dose is a huge problem. If you are giving just the standard adult dose, but you have higher exposure during pregnancy, you might get more toxicity for the mom and the fetus. Or if you have lower exposure during pregnancy, then you may not be getting the benefit of the medication. The mother's illness might get worse. If it's an infection, the infection could be passed to the fetus. So the consequences can be pretty severe for getting the dose wrong or incorrect during pregnancy. So for 20 years, I have performed many different studies on medications in pregnancy, figuring out the right dose. Almost always, your exposure to a medication is different in pregnancy than when in non-pregnant adults. you don't always need a different dose. Sometimes you have plenty of wiggle room. The drug still works, even though the exposure is lower or higher. But there are times when the exposure is so different during pregnancy that you actually shouldn't use that medication or should use a different dose. At the same time, once the baby is born at delivery, you still have exposure to medications through breast milk. And again, there are very few studies and very little evidence on how to incorporate any kind of knowledge or evidence into when you can safely breastfeed while you're still taking a medication. And again, the problem with not studying or not having evidence to base your decisions on is that there are times when women will stop breastfeeding to stay on a medication they need, and now the infant's not getting the benefits of breast milk. Or the parent may stop the medication so that they can breastfeed, and then the parent's disease may get worse, which can have bad effects not only for the parent, but also for the infant. So again, even knowing how much of the drug gets into breast milk, how much then gets into the baby's gut, if the baby can even absorb the drug, even if the drug is in the breast milk, that may not be a terrible thing if the baby's gut can't absorb it anyway. Sometimes it's a good thing. Sometimes you can, the baby might be getting a benefit from some drug that's in our medication ingested through the breast milk. So it's not like there's no one size fits all answer. You just need information to make an informed decision. So that's what I try to figure out. It's very complicated. It's difficult to do research in pregnancy and in breastfeeding. And in pediatrics, it involves the whole family. It also involves more than one patient. And there are, some ethical considerations you do have to take into account. It's challenging when the IRBs that approve medical research aren't used to seeing these kinds of studies. Sometimes they're difficult to get approved. It's difficult for some, clinicians don't want to participate because they feel like they don't want to experiment on pregnant women or lactating women or children. But again, the problem is if you don't do research, then these patient populations have zero evidence and have no idea how to safely use medications, even though we all need to use medications in these populations. So that's what I study and why, I guess.
Why have you chosen to pursue this question or problem?
Why this particular problem? So personally, it spoke to me that these are very interesting and, to me, incredibly important problems to solve. I can't think of much that I feel is more important than figuring out how to get, treatment decisions correct in pregnancy and early childhood, because that sets the tone for the rest of that baby's life. So, it has a tremendous impact, even though it's a time-limited, period of time, either pregnancy or lactation or even childhood. The consequences can be enormously long-lasting. So it's really critically important that we understand how to safely use medications in these populations. I'm interested in the math because I love math. I always have. So I find it interesting to know, it's not about just can you take a drug or not. Most of the time, it's about how much of the drug is the right amount to take to get the good effect without experiencing the bad. So, some people do research and just have yes, no questions, either, maybe yes, use this drug, or no, don't use this drug. And the problem with doing it that way, saying no, don't use this drug, it gets into the breast milk, or no, don't use this drug, it gets to the infant, is that, again, now you're losing out on the potential benefits of that medication. So I feel like the more subtle question of what is the right dose to use really then extends the treatment options for everybody, for the pregnant person, for the lactating person, for the infant, for the child. And then on a personal note, when I was learning how to do clinical pharmacology research and I was helping to write a study in pregnancy, I was pregnant myself. So there's always that, oh my gosh, this is so important because, I was pregnant twice myself. And sure enough, I used a couple of medications. Practically everyone has to use medications during pregnancy at some point. So it just really drove home to me that this affects everybody, every family. So that's why I do it.
As individuals and collectively as a society, what can we do to help answer the questions or solve these problems?
There is so much work to be done in these areas that there are an infinite number of ways that people can help, both as individuals, as societies, as professionals, you name it. So number one, ask questions, raise awareness. Whoever you're talking to, your family member, your neighbor, people you work with, your healthcare provider, your pharmacist. Hey, do we know anything about how to dose this drug or this medication in pregnancy or lactation or in my child? Or, if you are in the doctor's office or your family member is, let them know that you're curious. Well, has this been studied? And if not, how can I help? Like, what can I do to help solve this problem? So there are a number of things individuals can do. You can contact your legislators, your state legislators, your federal legislators, and let them know that we need laws that require studies in pregnancy and in lactation and in children. Again, we have a few in children. We really have very limited legal recourse to study drugs in pregnancy and lactation. So, and some legislators may not even be aware that we don't have these laws in place. So contacting them, volunteer to be in a study if you're pregnant, if you're lactating, if you have a child, and there's a study looking at the medication you happen to be using, please participate, give blood samples, give some, even just as much as a survey, answer a survey about, are you having side effects? How's the medication working? When you're again, at your provider's office, if you or a family member is pregnant and is using a medication, say, hey, can you submit my data to a registry, to a drug company, to the FDA, so that they can track whether or not this drug worked for me in pregnancy? So there are a lot of registries available that try to collect data on people who are already using these drugs anyway. So you can do that. If a person is lactating, they can donate breast milk along with a questionnaire listing out what they may be taking or what they may have been exposed to. So there are, for example, at UC San Diego, there's something called the Mommy's Milk Human Milk Research Biorepository. And they'll send you a collection kit, you do it yourself, and you can ship them a sample of your breast milk that they can then utilize in research studies to gain information about, medications and other things during lactation. You can donate, you can volunteer, you can donate money to a number of different organizations. So you can, again, contact your representatives about increasing funding to the National Institutes of Health, to the Child Health Institute specifically that funds this kind of work. You can donate to places like March of Dimes, American Academy of Pediatrics, things like that, foundations that help fund this kind of work. On my website at our pharmacy school, pharmacy.ucsd.edu, if you go to the gifts and giving, there's a Dean's critical use fund to be determined by the dean that I can utilize to help fund key research questions that don't otherwise have funding. Or just explore various websites like the Centers for Disease Control, the FDA, the NIH, on research initiatives in pregnancy and in lactation and in pediatrics, and see if there are any links there, any ideas of ways you can help, ways you can participate, volunteer to be in studies, and just raise awareness overall.